Christine. I'm Jen.
I'm Annalyn. Channeline.
And today we're going to perform a nursery care on a newborn baby. Okay, so after preparing all the materials needed, wash your hands and wear your gloves. Then feed the baby. And then get the baby, put the baby on your working place. Then after that, first you have to do is to clean the baby's umbilical cord. So by cleaning the umbilical cord, you will using a cotton balls with a dye. So you have to clean the umbilical cord 3 times and the area surrounds the umbilical cord. And then the cut, the umbilical clamp, the umbilical cord, and the area surrounds the umbilical cord. The cut, the umbilical clamp, the umbilical cord, and the area surrounds the umbilical cord. Then after that, of course, you have to secure the umbilical cord with a 1x1 OS. After, put the ID band on the baby's arm. We're using a blue ID band because our baby is born. Then after that, pour a lot of oil on the baby's all over his body. Avoid putting baby oil on the baby's umbilical cord because it can cause bleeding. Then first, you have to clean his face. So you will start from the eyes. So it's from inner canthus to outer canthus. Inner canthus to outer canthus. Forehead to nose. Forehead to nose. Cheek to chin. Cheek to chin. Forehead to chin. Forehead to chin. S, then inverted S, then small c, big C, big C. Then after, you will proceed cleaning his nose by using a aspirator. Okay, so clean his nose. Then, if the nose is not clean, you can use the cotton pads. And then, by cleaning his ears, you can also use a cotton pad. So, it's external pineal and at the back. External pineal and at the back. Then, after that, you will proceed cleaning his mouth. By cleaning his mouth, you will need a glass with the sterile water and a piece of cloth. By cleaning his mouth, you will dip your finger with the sterile cloth into sterile water. So, from upper and lower gums, upper and lower palate, inner cheek, the tongue, and the lips. Then after that, pour a lot of oil again into his head. Then clean his head. By cleaning his head, you can do a circular motion. Then arrange the baby's hair. Then proceed to his neck. Then proceed to his arm. From distal to proximal to axilla. 3 times. And same with the other one. From distal to proximal to axilla. 3 times again. Then proceed to his chest. So by cleaning his chest, you can do a circular motion. Just avoid touching the umbilical cord. Then after that, you proceed to cleaning his back. So you have to do this. And clean the baby's back. You can do a circular motion or a longitudinal stroke. Then proceed to the lower extremities. So same, from distal to proximal to ingroin. 3 times. And same with the other one. Then after that, you can proceed to his genitals. But first, before cleaning his genitals, you can clean first his anus if there is some fecal materials. So by using the fecal materials, you can use the baby wipes. While doing the procedure, you also observing the Apgar store. Then after that, you can clean now his genitals. So by cleaning his genitals, because our patient is a boy, so we have to retract the prepuce. So from the tip down to penile shaft, down to testes, and down to anus. So from retract the prepuce, so from the tip to penile shaft, to the testes, to the anus. And one more. From the tip, down to the penile shaft, down to the testes, and down to the anus. Okay, so it's just like this. So you will retract the prepuce. So from the tip, down to the penile shaft, down to the testes, down to the anus. Okay, so then after that, you can remove now your gloves. Then, you can do the final cleaning on the umbilical cord. By cleaning the umbilical cord, you can use pick up forceps with the cotton balls. But of course, you have to remove first the 1x1 OS. So the cut, the umbilical clamp, the umbilical cord, and the area surrounds the umbilical cord. The cut, the umbilical clamp, the umbilical cord, and the area surrounds the umbilical cord. The cut, the umbilical clamp, the umbilical cord, and the area surrounds the umbilical cord. Then after that, of course, you have to secure it with a 1x1 OS. And after that, we have to hit the baby's footprint. So by hitting the baby's footprint, we have to put the blue ink into his foot. So footprint is also another way for identification. And after that, we have to measure the baby's length. So the baby's length is 48 centimeters. Then we proceed to measure his head circumference. So the baby's head circumference is 33 centimeters. Then we proceed measuring his chest. So the baby's chest circumference is 30 centimeters. Then the abdominal area. Just avoid touching the umbilical cord. So the baby's abdominal area is 33 centimeters. And after that, we have to get the baby's vital sign. First, we have to get his temperature. So we have to clean first the thermometer in a circular motion. Then by getting the baby's temperature, we have to get it in his rectum because the rectum is the most accurate, and also this is to check if the baby has an imperforate anus. So the baby's temperature is 38.5. Then after that, we proceed getting the baby's heart rate. Okay, so by getting the baby's heart rate, we need a stethoscope and also a watch. So we have to get it for 1 minute. And after that, we proceed getting the baby's respiratory rate, also for 1 minute. By getting the baby's respiratory rate, we're just gonna watch his chest to rise and fall. Okay, so after that, we have to dress the baby. And after that, we have to apply a erythromycin into the baby's eyes. Erythromycin, this is to avoid gonorrhea conjunctivitis. Then, we will give the baby a vitamin K. But first, we have to clean his thigh. To give him 0.5 vitamin K. So the purpose of vitamin K is to promote blood clotting and also to prevent bleeding. And after that, we have to put some cotton balls with microtape. Then dress the baby. By dressing the baby, you have to do it very carefully because the baby is very delicate. Then put the baby's diaper. Then put the baby's mittens. First, you have to check inside the mittens if there is some excess thread to avoid baby's injury. Then pajamas. just one time. Then after, cover the baby. Then after, we have to weigh the baby. But first, we have to weigh his clothes. Then after that, we will weigh the baby. After weighing the baby, we have to subtract the clothes of the baby to get the baby's weight. Then after that, we proceed to giving him initial feeding. So the initial feeding, it's 1 ounce of sterile water and a pinch of sugar or oats. So the purpose of initial feeding is to check if the baby can suck and swallow. You don't have to finish the formula. Then after that, you